Hey folks, Dr. Garber here again. Today we're going to go over the clinical preparation sequence. We've got a wonderful assistant with us, an almost graduate, brand new DC, Julie. All right, so there's three things that we need to prepare before implementing any Cox protocols, and we need to prepare the table, we need to prepare the patient, and we need to prepare the doctor. So let's show you how we go back and do that. In terms of preparing the table, of course, we need some face paper, and just take a roll. There's no face paper holder. The headpiece has too many functions to fit a holder on it, so just get a piece maybe about 2 or 3 feet long, and then you can situate it. There's a little rubber square between the cushions that will hold the paper in place. All right, so in terms of preparing the table, one thing we want to make sure is that all the drops are disengaged and the locks are locked, because we don't want a patient to be surprised when they get on the table. You never know when someone has come along and engaged the drop, and we don't want a patient to be surprised like that. So just go over and fist bump the drop, and then make sure the table is fully locked and that the brake is engaged, and as long as this handle is parallel with the floor, the brake is engaged. The tiller bar should be in the down position anytime the patient is either going to mount or dismount. And then we would ask the patient if they have a preferred height. And of course, if you're in pain, you may want the table lowered as far as it goes, or you may want it raised. That's the patient's preference. And then we get the patient's weight, and we're going to preset the spring tension to the caudal section. And the way this works is you control the spring tension through these 2 buttons where it says tension, and the gauge is to the far right of the lighted numbers here. And for the average 150 to 200 pound person, we want to bring that to the number 5 position. Okay, so 150 to 200 pounds, bring it to 5. For every 25 pounds above that, we're going to go up 1 lighted position. So if they weigh 225 pounds, we would go up 1 lighted position. If they weigh 250 pounds, we would go up another lighted position. The opposite to that, again, starting at 5, which is for your average 150 to 200 pound patient. If they weighed 125 pounds, then we would go down 1 lighted position, and if they weighed 100 pounds, we would go down another lighted position. So that's how you get a general setting for the spring tension, so that the spring is not erratic and the table doesn't jump up and potentially injure the patient by moving too quickly. All right, so those are all the table preparation components. The next thing we want to do is prepare the patient. To prepare the patient, we want to make sure if they have a belt on that the belt is completely off. We don't want the belt opened, because we don't want the potential of any of the hardware on the belt to puncture the table. Okay, so Julie, if you would, completely remove the belt. And then, because Cox technique must be done skin on skin, the patient needs to loosen the garments. We suggest that they open the top button, lower the fly about halfway. All right. To mount the table, generally we're dealing with someone who's in a lot of pain, so we want to teach the patient how to stabilize their lumbar spine. We do that by a concept called increasing hoop tension. Hoop tension is the tension around the circumference of a cylindrical object. In this particular case, it would be the lumbar spine. And the way we increase hoop tension to the lumbar spine is we pull the belly button deep into the abdomen, and that tightens the rectus abdominis muscles. And then we have the patient also squeeze the buttocks together, and that tightens the glutes and the erector spinae. And we have them keep that, and then we show them how to get on the table that way. Okay. All right, Julie, so if you'll do that for us. All right, once the patient is on the table, bring the tiller bar up to where you would want it, and then raise the table so you don't have to bend over. Bring your work to yourself. Don't go to your work. Bring it up where you're comfortable. All right, to generally position the patient, we want the ASIS of their hips to be 2 inches superior to the inferior aspect of this thoracolumbar cushion. So Julie, I'm just going to find the ASIS. So she's a little high. We're going to bring her down this way. Good, right there. So her ASIS is right there, about 2 inches above the inferior aspect of the thoracolumbar cushion. We can now adjust the ankle rest, and we want just a little bit of plantar flexion. That's about right there. That just takes a little tension out of the lower extremity musculature. And then Julie, can we have permission to expose your back?
Yes.
All right, so roll the shirt up, get it out of your way, and then take the pant band and roll it down once. And that's a good work surface right there. All right, now the next thing we need to do is our first release of this caudal section. We should have the spring about where it needs to be. Actually, I did not ask her weight.
About 120?
About 120, okay. So right now we're at 5. So we're gonna bring it down one lighted position. And in her case, she's petite, so I'm gonna bring it down one more lighted position. That should be about right. Make sure the tilla bar is cinched tight. Take your knee or your thigh and wedge it up against the caudal section of the table to try and inhibit any erratic movement, and then slowly release the brake. Slowly release the brake. All right, it's fully released, and then see what you've got. Okay, so what we want is we want the table to go down easy, and we want it to come up without having to pull it up, and we want it to rest in neutral. So it's in extension, so we're going to get a little more tension out of that spring, and that's about perfect right there. So again, it goes down easy, comes up without having to pull it up, and it rests in neutral, and that's perfect. All right, and the last thing we need to prepare is the doctor. The doctor stands directly adjacent to the table with a wide stance. Find the patient's knee, put one thigh on either side of the patient's knee, get up front and close. The doctor is going to have to bend forward at the hips and still maintain balance, and the purpose of that is to get your fully extended contact arm directly going up the straight y-axis of the spine, okay? So, doctor is directly adjacent to the caudal section of the table with one thigh on either side of the patient's knee. The arm is extended to about a 30 to 45 degree angle. The shoulder is locked, the elbow is locked, the wrist is locked, and then the doctor would get his body weight, his center of gravity directly over the patient so that the arm is going directly up the y-axis of the spine, and that'll give you the perfect line of drive once you initiate the various treatment protocols. And that's the various preparation sequences. We've prepared the table, the patient, and the doctor.